Good evening, everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaz. Ultimately, the time for NEETPG 2024 has come, the night where we are insomniac, anticipating what is going to be the question paper. So, let's start a rapid revision paper. So, let's start. Yeah. So Dinesh is saying, is the exam postponed, sir? I'm not very sure whether exam is postponed or not. But yes, there is a possibility because few people are texting that exam is postponed. Until the official news is not yet concrete, let me conduct the insomnia session that we have planned as usual, assuming that tomorrow's exam is there. So let us see, because we don't know about what is true news, what is not a true news. But as a student, I prefer to believe that exam is going to be there, because how do we know that exam is postponed? Anas Abdul Jabbar is saying it is officially announced. Good. If that is case, still we'll have this session. So can the students can punch the voice loud and clear? I really feel sorry if it is really postponed, because lot of us are in the brim of getting that orgasm, ready to attack the exam, and suddenly this postponement makes us feel slightly terrible. So, but still, we need to persist, because we need to be in the game. That's the only thing. Nothing can be called a good news or a bad news. Yeah. Thank you, Ravi, for saying the voice is loud and clear. Good to see 21 online students to join this last minute insomnia session. So today we published the Sprint 16, which has got Dr. Prerna is asking, what about FMGA? No problem. We'll leak the paper and also get it postponed. Do you want that, Dr. Prerna? Right? So these are all called unforeseen contingencies. By that, there is not much of any difference. Rahul Vyas is saying that, sir, please confirm, is the exam postponed? I'm not sure. I just came from the hospital and just started the session. We will see within a short period of time. I just asked few people to confirm me. If they confirm, I'll reconfirm to you. Yeah. So let's continue the session, doctor. Thanks for joining the session. Now, yeah. So once you go to the Sprint 16, can the online students can punch the voice loud and clear? Yes. So you have the single liner topic classified rapid revision of the NEETPG 2023 to 2012. So if you look at the 2023 question paper of NEETPG, there are 54 questions which are all image-based questions. So remaining are all case study-based questions, very easy. So it's worth peeping through the 2023 as a single liners. Yeah. So There are about 1700 high-yield facts on the Spring 16 ebook on the learnograph.com. Yes. Fever, arthralgia, petechial rash, thrombocytopenia with a prolonged bleeding time. This clinical presentation classical of dengue. Which is the organism that exhibits twitching motility on a wet saline mount is the question of the examiner. So we should remember Trichomonas vaginalis classically is the organism. Thank you, Shravya, for saying that the voice is loud and clear. Thank you, Muhammad Manazir, Hussein, Sujit Reddy, and everybody who have joined online for this inevitable midnight Masala insomnia session. Whether exam is postponed or not, we are still in the war, we are still in the game, and we need to continue to be persisting in this game and fight until we win. So, doctor, trichomonas exhibit twitching motility on a wet saline mount. Typically, Leishmania tropica. It leads to ulcers and dark staining nuclei and kinetoplasts on microscopy is very classical. Owl's eye appearance, typically where do you see? Cytomegalovirus infection. Which infection can lead to bile duct carcinoma, cholangiocarcinoma. It is clonorchis sinusis infection which has got increased risk of cholangiocarcinoma. Pneumocystis are all darkly stained, crescent-shaped cysts on the Gomori methylamine stain is what you have to basically remember. A patient presenting with jaundice, fever, conjunctival hemorrhage, it almost looks like malaria, the leptospirosis. So microscopic agglutination test is the investigation of choice for diagnosing leptospirosis was the question in the NEETPG exam. We are talking about NEETPG 2023 exam. Right, doctor? Now, yes. Thank you for almost 16 online students being present in spite of postponement of exam. Good, doctor. So some of you may be preparing for FMG exam. They don't know when will be the re-exam. Re-exam doesn't take much time because it's all computer-based testing exam. So it's not difficult. Even if one paper is leaked, another paper will be started. That's not a big deal, right? So be in the game, continue the fight, don't lose the grip, be in the same exam fever mood, be in that insomnia of the exam mood, then only you will be able to fight. Right, doctor? So once more, Shravya, Pooja, Muhammad, Manazir, Sujit, and everybody. Is the voice loud and clear? Can you please punch, doctor? Is the size of the font on the screen, is it okay for all of you? So please go to learnograph.com and you can download the Sprint 16 ebook where you have 1700 PYQs out of total 10,000 PYQs. Thank you, Pooja, for the feedback that it is loud and clear. So now, rotavirus, how do you detect? Antigen detection in the stool sample is used to diagnose the rotavirus diarrhea. Plasmodium falciparum is indicated by a positive HRP2 antigen test in malaria. Which organism shows satellitism around the Staphylococcus aureus colonies in the culture when you do CSF culture? H. influenza is known to show satellitism. There will be Staphylococcus aureus colonies they release what is called factor X and factor V, and they are required. NAD is required for Haemophilus influenza to grow. So wherever Staphylococcus aureus is there, Haemophilus will be growing, which is called the phenomenon of satellitism, which is very, very classical feature, which you need to remember. Medial pterygoid, lateral pterygoid, masseter temporalis. They're all the favorite questions of the examiner. Lateral pterygoid is attached to the articular disc of the temporomandibular joint, is what you need to remember. It is the esophageal veins and left gastric veins which you see in the portosystemic anastomosis, is what you need to remember. The NEETPG 2023 single liner. So what are the vitamin K dependent factors, doctor? 2, 7, 9, 10. Basically, it is the gamma glutamyl carboxylase that required factors 2, 7, 9, and 10. Niacin deficiency presents with diarrhea, dementia, dermatitis, pellagra. So many times the question being asked. Which glycogen storage disorder presents with hypoglycemia, muscle cramps on exertion, decreased serum lactate? You should remember McCordle's disease, myophosphorylase deficiency. So every NEETPG you go, doctor, one question will come from glycogen storage disorders. Polished rice खाने से क्या होगा? Thymine deficiency. How do you identify? Thymine is identified by transketolase inside the RBC, the defect in transketolase levels. Wernicke encephalopathy, chronic alcoholism, confusion, ataxia, painful eye movements, painful ophthalmoplegia, right? So confusion, ataxia, the triad of features in case of thymine, Wernicke's encephalopathy. Whenever glycogen synthase deficiency is there, there is a easy fatigability. Increased hunger between the meals in children, which is one of the favorite questions of the examiner, which was asked in NEETPG 2023. Pedal edema, cheilosis, cardiomegaly, they're all the features of thymine deficiency. Whenever a chronic alcoholic is there, there's an increased urate and lactate levels leading to gouty arthritis. So what do you see in zinc deficiency, doctor? Acrodermatitis enteropathica. There'll be erythematous scaly patches, mucosal ulcers, impaired wound healing. Today only go back to the Google images and check for acrodermatitis enteropathica, how the lesions look like. When vitamin C deficiency is there in scurvy, why there is a poor wound healing? Because vitamin C is required for hydroxylation of the collagen, which it becomes a defective. So scurvy is due to defective collagen formation. As I told you many times, one MCQ invariably comes in NEETPG on the hormone sensitive lipase and lipoprotein lipase and lipoproteins, hyperlipoproteinemias and hypolipidemic drugs. Invariably 1 to 2 questions come in these 3 important topics, whether paper is leaked or not. That is the fact. When there is a low insulin to glucagon ratio, high glucagon, low insulin is there, that activates the hormone sensitive lipase. Alkaptonuria mein urine turns black on standing is what you need to basically remember. So, Gabbar Garg, Richie Rich, KK, everyone is saying exam is postponed. Probably exam is postponed, but our job to study is not postponed. डॉक्टर, राइट? हम पूरा प्रिपेयर होके आए, आपको सोने नहीं देना, हम भी नहीं सोना बोल के आगे, बीच में एग्जाम पोस्टपोन बोल के न्यूज आ रहे, क्या करेंगे? हाँ, सो एनीवे we are mentally prepared to persist in this game. Let's study for a while so that we don't know whether to cry or whether to laugh for this situation. Is it a good news or bad news? We don't know. But it is an inevitable news, right? So already we are all vexed, fatigued, waiting for the day to come. For the past 6 months, election, everything we got postponed. I understand. So that is the reason we need to persist, right? So those who are preparing for FMG, unless you have news in the hand, you need to continue to do the battle, right? So that's the reason. So once more, thanks for joining this session and giving me companionship at this late hour to fight the exam. Now, raw egg consumption से क्या होता? Biotin deficiency with thinning of the hair and scalp is called scaling. So it is called biotin deficiency. So you can see at least 5-6 questions came in NEETPG 2023 from vitamin deficiency, doctor, be very sure. Mental retardation, bone pain, inability to walk, cherry red spot on fundus, classical of Tay-Sachs disease. Once more, every NEETPG may. One, lysosomal storage disorder, mucopolysaccharidosis, invariably is asked in the entrance exam, doctor. So there is a link of learnograph.com. I'm leaving that link below. So there are totally 10,000 PYQs converted into single liners. Which year the question came, what is the topic from where it came, and what is that gist of that single liner question. That is the fastest way to do the revision of the PYQs cursorially, like pearls, right? Single liner pearls. Whether you go to NEETPG or whether you go to FMG, postponed exam or preponed exam, whatever. So you need to finish this 10,000 PYQs, doctor. Those who have not finished and had a half-cooked bacon, this is a good opportunity. When the exam is postponed, you need to double up your energy rather than get too cool about it, right? So once you finish 10,000 PYQs, we published books called Spring 7, 8, 9, 10, 11, and 12. 13, 14, 15, 16. Totally 10 sprint ebooks on the learnograph.com. I leave the link below. You can go to that link. And that gives you, we have given all these 10,000 PYQs. क्या बात है, हार्दिक काइमार से आप तो पढ़ाओ सर, ये NEETPG को तो इस बार क्लियर करके रहूंगा. वेरी गुड. इस इलेक्शन में हम जीतेंगे. Whether it is postponed or not postponed. Whenever it is postponed, you need to always look the life with incurable optimism, right? Everything we should think it will happen for our good. So the little more time is there, not stretch yourself and think that it is a God-given opportunity and finish the PYQs. At least if you finish the 10,000 PYQs, you get that kind of an internal authority, confidence to go and attack the exam. A lot of times we think solving 10,000 PYQs karna padta. But that is very slow way. You will never finish it. But if these PYQs, each of them is converted into a single liner sentence, what topic it came from, you will have a bird's eye view about the topic. Right, doctor? So, now, visual field defects. Every NEETPG exam, you can see NEETPG 2023 में left optic tract का lesion बताया. Then that will cause the loss of vision in the right half of both the eyes. So you should know very well superior quadrant anopsia, inferior quadrant anopsia, macula, sparing, visual field defect. All these things you should be sure. Wilson's disease, another favorite and very hot topic, NEETPG 2023 ka. Serum ceruloplasmin is the next investigation. If you found a Kaiser-Fischler ring in the patient, is what you need to basically remember. Very nice to see 40 online classmates. Don't dishearten, don't dishearten if the exam is postponed. Somewhere there is a calling, somewhere we have a feeling in the heart that we didn't finish our preparation. So that feelings you try to fill, even if it is 1 week postponement, 2 weeks postponement, 10 days postponement, it's another chance for you. That's how you need to look at the half full of the glass rather than the empty half of the glass. Understand? Then you will enjoy the life. A lot of times you think that there is a type 2 respiratory failure, I am losing the patient, but the patient may come back, CO2 levels may normalize, and then he will shake hand with you. Sometimes you thought the patient is recovered, about to go home, an emphysematous bulla will rupture, and the patient will end up in a respiratory arrest. So that is the reason. Pranav Malik, sir, I just bought the book Sprint 16. Yeah, it won't open on the phone because it's a large file PDF, Pranav. So that's the reason, kindly download it or transfer the PDF into the laptop. It will open. Don't worry. Okay. Yes. So very nice to see 40-45 students. So I want to tell you, every day I will be coming online for an hour to support you, to study along with you. And I provide you 10,000 PYQs as single liners in a series of book called Sprint PDFs. Please download from learnograph.com. Do the revision first. Then there are 50,000 high yield facts that you need to master. Every time entrance may, they ask the same questions. All right. So first, strategically, you should know what examiner wants. If you know that, to prepare is a cakewalk, right? So MSD is asking, how can I study again? Once a divorce is over, how do we marry again? Same way, right? So that is the reason, have that courage, take the best use of every minute of extra time that you are going to get. Fluorescent dye visualized under cobalt blue filter is used to diagnose the corneal ulcers. So intraosseous root access for giving IV fluids is performed by inserting a needle into the bone. This can come as a image-based question where they will show you the cannula which is used for the intraosseous root access. Now, in the rectal carcinoma, sympathetic nerve injury during abdominoperineal resection, if it occurs, it can lead to retrograde ejaculation and bladder dysfunction. So, for erection, there is no sympathy. That is, parasympathetic system lead to erection. and sympathetic nervous system lead to ejaculation is what you have to emphatically remember, basically. So MSD is saying, sir, I took leave and studied. Arey kya baat hai? And Chitra is saying, sir, हमने बहुत दूर travel करके आए हैं. Correct. We should put a public interest litigation asking government to compensate all of us, right? Because we lost a lot of things. This postponement, everything is causing, in spite of cyber security, so many things are there, but still postponements. But please take it positively. Every minute, today I thought Kabhi Albida Naa Kehna session with you as a midnight masala show for the NEETPG. But exam postponed. If you love cricket, India, Bangladesh cricket, maze mein khel rahe, right? So my son Abhinav Bharadwaz said, Dad, today let's enjoy the, what is that match? India-Bangladesh match. T20. I said, see, Sunny, you are in 10th class and all our kids are in their 5th class, 5 years MBBS, no? So 5th class kids need a little attention because tomorrow exam is there. So that's the reason I sacrificed the IPL and came for you. Itne mein a postponement ka news, right? But still, since we started a good Tyagaraja Kruti, whenever you sing, you should not stop it in the middle. So we'll persist for a while and then go forward.
Indian 4 wickets of fun.
Yeah. 4 wickets taken, eh? Okay. Good. So, very nice, doctor. If you are a cricket buff, please don't miss the World Cup. This video is going to be there on the YouTube. You can even watch tomorrow. But still, if you love to give me a little more company, I'm mentally prepared to spend midnight masala with you, right? So some of you are preparing for FMG, so please do persist on this. Don't forget to like this video, share this video, and write comments below this video after the video is over so that it become viral, right? So, and we want all of you to come every day 1 hour, whether I am busy in the morning with patients, evening I take opportunity to study along with you freely on the YouTube. Please do come. So, doctor, lateral cutaneous nerve of the thigh is typically injured. It is called meralgia paresthetica. After a hernia repair, whenever there is any pain along the lateral part of the thigh, you should think of lateral cutaneous nerve. If the eyes are opening to pain, inappropriate words, withdrawal from pain, we call E2, V3, M4 on GCS score. So 2 to 3 scores will be asked in every NEETPG exam, doctor, be very sure. Echinococcus hydatid cyst can lead to hematocellular carcinoma. Whenever there is any chronic pancreatitis with intraductal calculi. So how do you identify chronic pancreatitis, doctor? You should know. This is one of the favorite questions of the examiner. If you take plain radiograph in chronic pancreatitis, there will be calcification of the pancreas. So in the area of the pancreas, there will be calcifications if you find that is chronic pancreatitis. What is the scoring pattern to grade the degree of severity of the acute pancreatitis called as Balthazar scoring is what you need to remember. Is the pancreatic necrosis peripancreatic collections? They are only occupying less than 1/3, more than 2/3, between 1/3 to 2/3. That's how you grade, is what you need to remember. So, you need to remember chronic pancreatitis, whenever chronic pancreatitis is there, Longitudinal pancreatico-jejunostomy is the one which we will do. There are Panchabhut, like 5 Vayu, Agni, Bhumi, like that. There are 5 conditions: HSV, syphilis, LGV, chancroid, gonococcus. You should know invariably 2 to 3 questions come from these 5 STDs. You have to be ready with. Syphilis presents as a painless genital ulcer, non-tender inguinal lymphadenopathy is what you need to remember. There is one big dirty list of cephalosporins that you need to remember, doctor. So Saurabh Potare is saying, sir, when is the FMG PYQ PDF is getting published on learnograph.com? Thank you, Saurabh. You are always, students are inspiration for a teacher to work and come out with the PDF. So if you look at FMG exam, 2023 say 15 years PCLL, 2008. There are totally 15,000 PYQs, and each MCQ is converted into a single liner, topic classified, which here mentioned, and we are creating a PDF. It takes another 2-3 days, right? Our guys are still working, right? Now, definitely that's going to help you, because beyond this 15,000, what else examiner can ask, right? So, yes, those who are feeling unhappy, elated, depressed about cancellation, you can enter all your comments in the chat window. I'm continuing this session in spite of postponement only to let you out your feelings, so that as a community, we are still one together to fight the battle irrespective of the date, right? So please feel free. Miracle is Doc is saying, this is wonderful compliment. Sir, we need another midnight series again. Yes. In last 25 years, I had opportunity to spend with the students before the day of exam 25 times. Can you imagine? 25 All India PG medical entrance exams, I was with the students on the night before. Of course, there are some exams with postponements. Those days, news used to be not this fast, right? At the same time, never this rapid. Like, कल independence आ रहे, August 15th को, August 14th को, जैसे ब्रिटिश वाले ने डिक्लेयर किया, आजकल डिक्लेयर कर रहे हैं, YouTube, NDTV इधर उधर फटाफट आ रहे. एक जमाने में इंटरनेट इतना कहाँ है? 25 years ago, right? So I'm always there for you, doctor. Every day I come 1 hour, spend time with you. What you need is more than any coaching, any app, any plan A's, plan B's, ratta sessions, batti sessions, or crash courses. What you need is a classmate. 2 to 3 good classmates who will sit with you, hold your hand, study along with you. I will give you the wonderful, highly focused study material in the form of PDFs, ebooks published on the learnograph.com. You form a group of 8 to 10 students together. One of you can download and can share with all your friends freely, no problem. But you come every day to this free session on the YouTube. रोज हम पढ़ेंगे, रोज हम मिलेंगे, और एक दिन कामयाब होके दुनिया को बताएंगे, भाई मेरा नंबर आ गया, right? So that should be the plan, doctor. So Sangeeta says, sir, I took leave and studied to exam. How is it possible that the God can be so irrational? In Pathology, Robbins' textbook, there is a beautiful statement I will never forget. The histopathological features of the tumor are so confusing that it has got clear cells instead of dysplastic cells, though it is malignant. But it is more irrational to expect the histopathology to be rational by the creation of the God. We humans ourselves are irrational, and our expectation to expect the histopathology to show the dysplastic features is more irrational. So also, expecting examiner, all these NTAs, all these political bodies, very difficult, doctor. But we need to continue the game, right? So now, syphilis presents with a painless genital ulcer. So cephalosporins, that list you need to remember, doctor. Cefazolin is the drug of choice for preoperative antibiotic prophylaxis in cardiac surgery. Whenever you have a BRAF5 breast lesion, if there is a estrogen receptor positivity, it falls under the good prognostic factor. Once more in the breast carcinoma, every NEETPG, without a question on breast carcinoma, there is no question paper. Dr. Shamu says, I left my 2 kids to my mom. Both are having viral fever. My center is in other state. Took 2 flights and now reached the nearest center. Really. My prayers are with you, Dr. Shamu. Really, we pass through such a hardships to become a doctor. And the expectations of the family, patients, everybody on us, miserably, they expect us to be superhumans. The other day, one of the patients said, Dr. Sahab, आप भगवान है. मैंने बोला, भगवान भी नहीं हूँ, शैतान भी नहीं. You recovered not because of me, or that bed number 4 patient deteriorated, even not because of me. I am just a vehicle in the hands of the God, and your own physiological system is helping you to recover, right? So some patient arrived just within 10 minutes after ST elevation may have about 30 to 40% of the ejection fraction fallen down. Another patient 8 to 10 hours के पहले ST elevation हुआ और lately आया, फिर भी ejection fraction is 60%. We don't know. So the whole society expects us to be superhumans. Unfortunately, we as doctors, never we cure, sometimes we palliate, but always we only comfort the people. So I really feel sad about it, Dr. Shamu. But whatever the little time left, let's not lose the spirit of fight. That is most important, doctor. That's the reason I want to hit 12 p.m. tonight with all you comrades on this wonderful evening, memorable evening together. So, aortic dissection. So once more, you should know DeBakey classification of aortic dissection. Whenever aortic dissection involves the ascending aorta, then aortic valve become destroyed, and that leads to severe aortic regurgitation and death. That's the reason, if it is whenever it involves ascending aorta, aortic dissection need to be surgically treated. If it is only involving descending aorta, it can still be maintained medical management. So whenever sudden chest pain is there, widened mediastinum is there, differing blood pressure in the arms, then you should think of the possibility of aortic dissection is what you need to remember. So, Rini, Weber, absolute bone conduction. Every entrance NEETPG 2023 में भी आया है, हर एक entrance में आता है. Rini negative at 256 and 512 and positive at 1024 hertz suggests a 30 to 45 decibel air-bone gap is what you need to remember. Whenever there is any liver abscess larger than 20 cc, then percutaneous drainage is the next step. Whenever white patchy lesions on the oral cavity are there, think of oral candidiasis, and clotrimazole is used to treat. Whenever there is any weakness of conjoint tendon, that lead to direct inguinal hernia. Once more, every NEETPG when you go, every FMG you go, every INICET you go, invariably there is a question on direct, indirect inguinal hernia, femoral hernia, obturator hernia. All these things you have to be 100% sure of. Whenever postpartum hemorrhage is there, we can't give carboprost because it leads to bronchospasm, especially in asthmatic patients. Whenever continuous exposure to drills and machinery, it can cause white fingers, which is because of the Raynaud's phenomenon. Anything about amidaron, you need to be very sure, doctor. Amidaron can cause pulmonary fibrosis, fatigue, dyspnea, and weight gain. So all the side effects of the amidaron you need to be very sure about. A rectal mass in a child with a mucin-filled inflamed gland is a hematoma. Salicylate poisoning you need to do alkalinization of the urine by administering soda bicarb is what you should remember. Once more, tricyclic antidepressant poisoning, salicylate poisoning, lithium toxicity, digoxin toxicity. These are the 4 to 5 drugs. Every time NEETPG, they will ask a question on the clinical management of these conditions. Allopurinol, it inhibits the uric acid synthesis and reduces the gout symptoms. But what is important, caveat about allopurinol, doctor, if you look at the NEETPG 2023 itself, there are 3 to 4 questions on gout. Probably tomorrow exam would have been there would have been 2 to 3 questions invariably on the gout. Paper out, right? So, one thing you need to know about allopurinol is it is never given in acute gout. You can only give it in chronic gout. Prophylactically is what you need to remember. So what do you give in acute gout? We give indomethacin. Suppose if indomethacin, there is any contraindication in acute gout, we give colchicine. So everything about the gout drugs, you should be ready for your exam, doctor. So I'm telling you, sprint ebook PDF on the learnograph.com. I leave the literature for you, the link of learnograph.com below. Sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Totally 10 sprint ebooks made. I converted MCQs into single liners, provided the topic they belong to, and take every opportunity. कितने देर में आप खत्म कर सकते? You can only see here. Almost 50 questions we finished in about half an hour. 1 hour में 100 questions, 100 hours में 10,000 PYQs का revision आप खत्म कर सकते. कुछ भी पढ़ने की जरूरत नहीं है. Only 10,000 PYQs को 2-3 मर्तबे पढ़ के भी आपको सीट मिल सकता. But you should never study or read PYQs alone. आपके साथ एक 4-5 ग्रुप रहेगा. ग्रुप में आप भजन करते हुए रिवीजन करना, क्योंकि आपको लॉजिक मालूम नहीं है तो दूसरों को मालूम होगा. तो एज ए ग्रुप यू नीड टू डू द रिवीजन ऑफ PYQs. Oprilvecin, interleukin 11, it is used to treat the chemotherapy-induced thrombocytopenia. So every NEETPG, one question comes on monoclonal antibodies, receptor blockers, interleukin, CD markers, all these things list बना के revision करना. Losartan, it acts like a thromboxygenative antagonist and it inhibits the platelet aggregation. The simple losartan, the ARP, angiotensin receptor blocker. Durkan's test is used for carpal tunnel syndrome. Carpal tunnel syndrome में median nerve, all of you know. What are the boundaries of the carpal tunnel? Every NEETPG, if you look at the 10,000 PYQs and hit how many times carpal tunnel is asked, at least there are about 10 to 12 times carpal tunnel came. That's the reason very important topic. Eczema overlying the varicose veins corresponds to C4A in CEAP classification. Once more, varicose veins is a hot topic for the NEETPG. Subarachnoid, every entrance you go, extradural hematoma, subdural hematoma, subarachnoid hemorrhage. A combination may definitely 1-2 questions come. Thunderclap headache, kahan hota hai? Subarachnoid hemorrhage. So we do angiography in subarachnoid hemorrhage. Feeding jejunostomy is the best management for complete dysphagia because of the sodium hydroxide ingestion. Whenever there is a midline neck swelling that moves with deglutition, with a tongue protrusion, thyroglossal cyst, trunk operation, everything, anything about it, you should remember. So Ravinder says, sir, please talk with me. Feeling little depressed after next NEET got postponed. Ravinder bhai, आपको हर एक can you get me some hot lime water? What is the score now?
India won by 50 runs.
India?
Won by 50 runs. When India by 50 runs.
India won on the Bangladesh. Wow, that's good. I missed the match. So Ravinder, I am also feeling depressed missing the India-Bangladesh match where they have won the match. Wow.
By 50 runs.
Already won, eh?
By 50 runs. 5-0.
Okay, 150 is their score and finished. Eh? Wow, that's wonderful news, right? So Ravinder, feel happy. You are getting almost 80% score in every mock test that we conducted. Depressed होने का क्या बात है? Life is a small surprise. We should unfold our hands and embrace the life as it comes to us. There lies the ingenuity of the human race and human beings. So it is not a calamity. See, imagine the situation. One of my niece, NEET UG में अच्छा rank आया. We all celebrated. Suddenly they are saying NEET UG may get cancelled and retested. So that is more miserable situation. So postponement utna miserable nahi hai. So that's the reason. Just reinforce yourself and prepare, doctor. I am still there with you for any number of NEET-PG exams, right? So Q-SOFA, it has systolic BP, respiratory rate, and GCS score to predict the prognosis and hospitalization duration is what you need to remember. So कितना scores आ गया NEET-PG में? Glasgow Coma Scale आ गया, Q-SOFA score भी आ गया. Tearfulness, mood swings, occasional insomnia, 4 days postpartum indicate postpartum blues. So you should know how to differentiate postpartum depression, postpartum psychosis, postpartum blues. 3 conditions, how to differentiate. Favorite question examination. हमको क्या मिल गया हो गया प्रीपार्टम ब्लूज है पोस्टपोनमेंट के वजह से. So don't get into the depressed mode, right? So Rajesh Jangir is saying, sir, I want this PDF. So please WhatsApp to our helpline, doctor, 9000-868-356 and be part of our WhatsApp study group, and go to learnograph.com. You have Sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. So totally 10,000 PYQs from 2012 to 2023 NEETPG. We converted into single liner along with the topic, which year it came, for you to do a quick cursorial revision, Dr. Rajesh. So learnograph.com, it is available. Right? Now, recurrent episodes of anxiety, palpitations, feeling of impending doom. Doom is equal to panic disorder. Once more, anxiety disorder, schizophrenia, right? Then bipolar disorder, depression and mania, personality disorders, autism, attention deficit hyperactivity disorder. Totally around 12 to 15 topics is all that you need in psychiatry. And it takes no time. Every time, every subject, if you are rightly preparing with the right material, every subject you should be able to revise within 8 to 10 hours. उससे ज़्यादा पढ़ रहे तो then you are missing something. Whenever dialysis disequilibrium syndrome, where patient develops drowsiness, seizures, hypotension after dialysis, we give IV mannitol as the treatment. Once more, indications of dialysis, reversible, irreversible things in renal failure by dialysis. You need to be very sure about that. Whatever, हम बहुत खुश हैं. 48 online students even attending this midnight Masala show. Right now, whenever there is any tachycardia, atrial fibrillation, hyperthyroidism in a patient who has got asthma, generally tachycardia, atrial fibrillation, we give beta blocker, but patient has asthma. So diltiazem is the one which is used for immediate management. In respiratory distress syndrome, when hyaline membrane is formed, surfactant deficiency is there. What is the cause? Typically, increased surface tension, decreased compliance is the pathophysiology of respiratory distress syndrome. Joshua is asking, sir, did you hear the news of postponement of exam? मैं तो अंधराज धृतराष्ट्र हूं. पांडव कौरव सब लोग ने कल कुरुक्षेत्र जाने के लिए तैयार हो रहे हैं. इतने में विदुरा ने आके मुझे बताया, हे अंधराज धृतराष्ट्र, कल जंग नहीं है बोल के. फिर भी we need to keep ourselves patent, maintain that grit, defiance, winning spirit, fighting spirit, and take this postponement more as a positive way is what I want to tell all my wonderful students. Krishi is saying, it only got postponed, not cancelled. इसलिए रोने का जरूरत नहीं है. Right? Now, premature ejaculation क्या होता है? How to treat it? Ask the partner to squeeze on the buttock every time the guy is about to ejaculate, so that the game will continue a little longer. So what the NEETPG examiner is trying to do by this postponement is squeeze technique, doctor. So he's squeezing the skin noxiously. Oh, you are having that moaning sound, and you need to continue your preparation, the game, until the right time to ejaculate comes. That's called squeeze technique, is what you need to basically remember. Now, hepatitis B management. Tenofovir, for more than 40 weeks is the treatment, especially when there is an elevated SGPT in chronic hepatitis B. What will happen in hyperkalemia? Why hyperkalemia lead to development of the cardiac arrest? It will make the resting membrane potential more positive. So how do you treat hyperkalemia, doctor? We give glucose plus insulin. Why do we give that? We give insulin so that insulin will drive the potassium intracellularly, so hyperkalemia comes down. But even before giving the insulin plus glucose, we give calcium gluconate, because calcium gluconate will stabilize the cell membrane, because hyperkalemia increases the resting membrane potential and predisposed to ventricular fibrillation and cardiac arrest is what you need to remember. Now, respiratory distress syndrome in newborns. So Dr. K.T. Patel is asking, sir, FMG hota ya nahi hota? Elder sister का engagement postpone हो गया तो younger sister का शादी रुकता बोल के गारंटी नहीं है, वो as usual continue हो सकता. So continue to prepare, doctor, whatever be the news. Histoplasmosis. HIV with disseminated histoplasmosis presents with umbilicated papules and multiple bilateral nodular infiltrates. Dorsal column is passing ipsilaterally, whereas spinothalamic tract carrying the pain and temperature will go contralateral. So whenever cervical spine injury is causing dorsal column tract injury, there will be loss of ipsilateral arm proprioception is what you need to remember. So vibration proprioception is all done by the dorsal columns is what you need to remember. Both the temporal lobes inflamed, hemorrhagic necrosis of the temporal lobes on MRI is a feature of herpes simplex virus encephalitis. Favorite question of the examiner. Once more, go to the Google images and look at an MRI of HSV encephalitis leading to temporal lobe inflammation. A lot of times it is asked as a image-based question down. Now, very good, Krish. We have to study. There is no other option. And get ready ourselves for the exam, right? So, subacute combined degeneration. Why we call combined degeneration? Whenever there is vitamin B12 deficiency, why do you call subacute combined degeneration? What is combined about it? In combined degeneration, there is a dorsal column involvement, hence there is a proprioception loss. Proprioception क्या होता है? Sensory. There is also pyramidal tract which get demyelinated. That is the corticospinal tract. That's the reason there is an upper motor neuron weakness. So both motor is there and also sensory is there. That is one cause for calling it combined. Same time, the demyelination due to vitamin B12 deficiency lead to peripheral nerves lose their myelin. That's the reason there is an absent ankle jerk, which is a sign of LMN. So both UMN weakness and LMN areflexia is there. That is another reason we call it as combined degeneration. So it is called subacute combined degeneration of spinal cord. So whenever DKA is there, how do you treat? So the initial management of severe dehydration and DKA is ABC. Airway, breathing, circulation. You need to give normal saline 20 ml per kg, and then you need to, what will you tell? Sister, start 15 units of insulin subcutaneously and 50 units, add it into the normal saline and run it as a drip at 50 microdrops per minute. Then an increase in the length of 25 centimeters in the first year indicates adequate growth in infant. Once more, head circumference, when will length double? These are all the favorite questions of the examiner. Mid-diastolic murmur, prominent A wave on the JVP, classical feature of tricuspid stenosis. Once more, heart sounds, JVP, murmurs. Invariably, one MCQ will come in the tomorrow's NEETPG. Progressive spastic paraparesis, gait instability in a farmer who is eating diet of rice and pulses is due to vitamin B deficiency. Chloride level in the sweat is a feature of cystic fibrosis. Fever and a rash spreading from face to the body with Koplik spots is equal to measles. Tracking the BP from childhood to adulthood, there's a correlation between childhood and adult BP. The more the blood pressure in the childhood itself will lead to hypertension when they become adults. Whenever there is a paroxysmal cough followed by apnea and a high WBC count, we are talking Bordetella pertussis. Azithromycin is the drug which is prescribed. What will Asha worker will do? She is responsible for counseling and providing information to pregnant women avoiding certain fruits like papaya lead to abortion. Lot of misconceptions will be there for the patients. Asha worker need to change all that. God bless me is saying, sir, so jaiye, NEETPG is postponed. No. NEETPG postponed, but NEETPG spirit of war, battle is still live in us. So today we came with a killing spirit to conduct a insomnia session. NEETPG ho ya na ho, hum to khatam karke hi niklenge. Okay? So, cervical erosion. Yellow kit should be given to the patient who has got a minimal vaginal discharge, cervical erosion to a sexually transmitted infection clinic. So once more, chlamydia, trichomonas vaginalis, gonococcus, candida in the case of the woman. Similarly, LGV, syphilis, chancroid, lymphogranuloma venerum, all these things, STIs, definitely 2 to 3 questions come. The years of potential life lost is attributed to the years lost due to premature death. As a part of the school immunization program for a 10-year-old child, we give TT or TD vaccine. The ear pain in recurrent tonsillitis is because of the referred pain carried by tympanic branch of the glossopharyngeal nerve. Colombo plan includes setting up a cobalt therapy unit for cancer treatment. Bova beta-oxalyl aminoalanine toxin, it leads to progressive spastic paraparesis and upper motor neuron paralysis in farmers. A single dose of tetanus toxoid is best management for a clean-cut wound in a previously vaccinated patient. Whenever disease outbreak is there, collect the water from a gentle stream and avoid splashing for bacteriological examination. The water collection technique you should know. Whenever you suspect varicella in a hostel outbreak, isolate for 6 days after giving acyclovir. So that is the management of varicella and its isolation. Lifelong, you need to give the vasopressin supplementation for diabetes insipidus which occur after doing the pituitary dissection. Post hypophysectomy is what you need to remember. acute pain, lancinating pain in the great toe, synovial fluid is showing rise in leukocytes. It suggests acute gout is what you need to remember. Always wait 8 hours before resuming the digoxin treatment. Once there are side effects and the serum concentration is 4 milligram per deciliter. So you should know what is the half-life of digoxin, what are the drugs that lead to digoxin toxicity. Quinidine, procainamide, they are all predisposed to digoxin toxicity. Hypokalemia lead to digoxin toxicity, but digoxin toxicity by itself lead to hyperkalemia is what you need to remember. Sudden rise in temperature after atropine infusion in OP poisoning. Atropine is anticholinergic. Anticholinergic will lead to sudden rise in temperature. Tissue plasminogen activator is a thrombolytic that increases the fibrin degradation. Once more, anticoagulants, thrombolytic agents, favorite question. Whenever Asherman syndrome, uterine synechiae with amenorrhea, hysteroscopy is preferred. Iron supplement should be started at 8 to 10 weeks of pregnancy for a primigravida with anemia. Once more, antenatal checkups. What is the dosage of the folate, iron supplementation? Everything you should know, doctor. Necrotizing cervical growth with lateral parametrium involvement when it is there in cervical cancer. We give chemoradiotherapy. Whenever lower abdominal pain, minimal discharge, intermenstrual bleeding is there, think of genital TB. So what is the disadvantage of laparoscopic surgery? We cannot know the extent of the thermal burns that have happened. That's the pitfall of laparoscopic surgery, which is minimally invasive. External cephalic version, what are the indications, prerequisites, everything you should know. It is recommended for management of a transverse slide at 36 weeks plus 6 days of pregnancy. Single dose methotrexate injection. It is a treatment in ectopic pregnancy. The patient is hemodynamically stable. So once more, every NEETPG make ectopic pregnancy, endometriosis, endometrial carcinoma, ovarian carcinoma, carcinoma of the cervix, contraception, infertility, like that. You can predict at least 25 out of 30 questions from gyne-ops are highly predictable. Every entrance you will get one. During hysteroscopic surgery, pulmonary edema is an immediate complication of the fluid deficit. Whenever a woman is diagnosed with advanced cervical cancer, you need to advise the HPV vaccine to the daughter. So once more, doctor, you should very much clear and review everything, anything about the HPV vaccine. Whenever there's a primary amenorrhea, no secondary sexual characters, absent reproductive organs, like in Turner syndrome, there is a ovarian dysgenesis, then what will happen? The estrogen levels are low and that stimulates FSH, LH to be high. So hypergonadotropic hypogonadism will be there whenever primary amenorrhea with no secondary sexual characters and no reproductive organs are there. You get hypergonadotropic hypogonadism. Whenever there is a bulk of the tumor, we give neoadjuvant chemotherapy. We give chemotherapy to decrease the disease burden, like in breast carcinoma, before the radical surgery to reduce the bulk of the tumor. A woman who has twins and a current pregnancy, what is your obstetrical score? G2P1. So you should know how to write the denomination very, very clearly, doctor. So, peptic ulcer. Any patient taking aspirin and alcohol with sudden onset of hematopoiesis, बोल के clinical minute दिए तो it is peptic ulcer. In the late pregnancy, when the woman is lying on her back, if there is a feeling of lightheadedness and giddiness, it is IVC compression by the gravid uterus responsible. So what is the relation between intensity of the radiation to the distance from the source? Intensity of radiation is inversely proportional to the square of the distance from the source. Datura poisoning is caused by fever. It will cause fever, confusion, urinary tension, because Datura is what? Anticholinergic, like atropine. So Datura anticholinergic effect is, what will it do? Acetylcholine stimulates the detrusor to contract. If anticholinergic is there, detrusor is prevented from contracting, leading to urinary retention. So you need to give a cholinergic drug like physostigmine to treat the anticholinergic effects of the Datura poisoning is what you need to remember. The pain and swelling under the earlobe in conditions like leprosy is because of the great auricular nerve. This is one of the favorite questions, doctor. The whole of the face is supplied by trigeminal nerve, sensory supply, except the area under the earlobe along the angle of the mandible, the skin overlying it, it is supplied by great auricular nerve. That is what you need to remember for the tomorrow's NEETPG exam. The whole of the face, motor supply of the facial muscles is supplied by facial nerve. Except, what is the except? Levator palpebrae superioris, which lifts the eyelid, is supplied by oculomotor. So in oculomotor neuropalsy, what will happen? Levator palpebrae superioris get paralyzed, and that lead to ptosis in case of oculomotor palsy is what you should remember, doctor. So wherever logic is involved, you need to logically understand it. So I give to you most concentrated, focused material that you need to read, doctor. आप USMLE लिखो, INICET लिखो, FMG, NEETPG, any damn dusky exam. There are not more than 40,000-50,000 high-yield facts that you need to master. But what is important? What is that fine aspect of that story you should know? Like Liddle syndrome, Bartter syndrome, Gentleman syndrome, Gordon syndrome, renal tubular acidosis, type 1, type 2, etc. Logically, you should understand. Glomerulonephritis like topics, they're all factual. 1, 2, 3, 4, 5. Which glomerulonephritis you see in HIV patients and drug abusers? FSGS. Which glomerulonephritis you see in patients with lymphoreticular malignancy like lymphoma? Membranous nephropathy. Where do you see tram track appearance? Membranoproliferative glomerulonephritis. In which glomerulonephritis you see typically hematuria occurring 3 weeks after the sore throat? Post-streptococcal glomerulonephritis. Where do you see that hump-like appearance? PSGN. Glomerulonephritis like topics are all what? Facts. 1, 2, 3, 4, 5, 6. You need to calculate. Whereas there are topics like diabetes insipidus, secondary hyperparathyroidism, right? And Conn syndrome, pheochromocytoma, nephron physiology. What happens in ascending limb of loop of Henle? How do the various diuretics function? What are the indications of the diuretics? Why the diabetes insipidus, which is a diuretic state due to ADH deficiency, even though it is a diuretic state, why do we give thiazide diuretic to treat it? कोई बेवकूफ डायरेटिक स्टेट में डायरेटिक को ट्रीटमेंट देता क्या? डायबिटिस इंसिपिडस इज ए डायरेटिक स्टेट, उसमें डायरेटिक को देता क्या? फिर भी देते क्यों? उसके लिए एक लॉजिक रहता. सो लॉजिकल thing should be understood, right? Logical thing should be understood logically. And facts, एक्सट्राऑर्डिनरी का लेंथ कितना होता है, यूरिटर का लेंथ कितना होता है, ईसोफेगस का लेंथ कितना होता है, व्हाट लेवल पे ट्रेकिया बाइफर्केशन अक्कर, all these things, chiller chitka things which are muggable, you need to mark. So whenever you start your preparation, what is important? There are 10,000 PYQs. Everybody will say PYQ revision karna. Magar kaise karna? If you sit and start solving it logically with a blank mind at the start of preparation, it won't be interesting. Instead, we published PDFs on the learnograph.com called Sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Totally 10 PDFs, Sprint PDFs on learnograph.com. Download them. Every PYQ converted into a single liner, classified into a topic, which year it came, and made available to you. Completely with a blank mind. Right? Nischinta, Nischalata. Equilibrium and Nischinta. Run through the 10,000 PYQs sitting with 3-4 friends. So क्या हो गया? 10,000 में already you know 3-4,000 PYQs because you studied MBBS. है ना भाई? 5 साल, maybe couple of girls dumped you and you dumped a couple of girls and finally fixed with one girl, got immunized and vaccinated. Right? Doesn't matter, but कुछ तो पढ़ा ना. तो जब हम पढ़ते हैं, जब हम पढ़ाई करते हैं 5 years, we obviously know, after finishing, we know at least 3,000 to 4,000 of these questions, we know the answers. So the remaining 5,000-6,000 where you are not completely clean bowled, like methylmalonic aciduria is in vitamin B12 deficiency, how many ATPs are produced in fatty acid biosynthesis, used in fatty acid beta oxidation leads to how many ATP production. So the facts which you became first time aware of the facts, those facts must drive you to identify what are the 500-600 topics which are constantly asked by the examiner, whether you go for NEETPG 2023 or 24, 25, 26. सदियों से वो टॉपिक्स पूछ रहे examiner, like ketone bodies, endometrial cancer, contraception, right? Invariably questions come. So once you fix up your mind what to read, you know what is the game, what is the limit of the game, then you know how to win it, and it is easy to win, right? So I'm there with you. Every day I will come online for 1 hour, hold your hand, become your classmate, roommate, table mate, benchmate, inspire you to prepare, whether exams get postponed or not. मुरली भरद्वाज तो सदा सदा के लिए आपके साथ रहेगा जब तक आपके ख्वाब, your dream seat comes true in the clinical specialty branch where you want to become the winner doctor. So that's the reason. Arise, awake, and stop not until you win what you wanted in life. Letulay technique in autopsy. It involves removing organs enmasse from the tongue up to the prostate. खींच के निकाल देते. One autopsy आप देखे तो आप भूलेगा नहीं. Letulay technique. Rokitansky technique is the method of autopsy for a HIV positive patient. So examiner is so obsessed about the autopsy. CSF PCR for viral DNA confirms the diagnosis of HSV encephalitis. So once you get positive filarial antigen test, you need to detect the microfilaria in the blood smear. So what is Barberio's test, Dr.? Yellow needles shaped rhombic crystals with picric acid in the perianal region indicate a positive Barberio's test for the semen detection. 2/3 of the Mendelian disorders are all predominantly autosomal dominant. Once more, you need to make a list. Autosomal dominant, autosomal recessive, sex-linked dominant, mitochondrial inheritance, what are their pedigrees, what are the examples, which will horizontally transmit, which will vertically transmit, consanguinity leads to what, where do you find incomplete penetrance, where do you find pleiotropism, etc., etc. Whenever strychnine poisoning is there, patient will have seizures with the arching of the back, and multiple episodes would suggest strychnine poisoning. In biliary atresia, there is a conjugated hyperbilirubinemia and periductal proliferation on liver biopsy, classical histological feature. So once more, go to the Google image bank and try to check for the biliary atresia histopathology, doctor. Now, the death of the mother by an act done with an intent to cause miscarriage. It is dealt by 314 IPC. Every NEETPG, one IPC will come. There are totally around 20 IPC sections you need to remember, like a parrot for the tomorrow's exam. So if you solve this 10,000 PYQs like single liners in about 100 hours, then you know what to read, what to not read. You don't need any coaching guru at all. Congenital cytomegalovirus. How does it present? Hepatosplenomegaly, thrombocytopenia, periventricular calcification. Once more, torch group of infections. Toxoplasma, rubella, CMV, herpes simplex. You need to know, right? Congenital varicella. You need to know 2-3 points about each of them. So whenever a deceased person, post-mortem caloricity is there, septicemia is one of the causes for elevated body temperature in a dead body, if the death is because of septicemia. Whenever sputum is negative and you are suspecting the TB, then NAAT, NAAT test is the best next test. So once more, the revised National Tuberculosis Program, everything about the TB treatment, definition of the different types of TB cases, who is a relapse, everything you should know. भारत होता है सांप पकड़ने वाला लोगों का देश. इस देश में न जनाजा, viper, sea snake, all these snakes, one snake, one scorpion based question definitely will come. Severe pain, bleeding and blister formation at the wound site, viper bite. What is the cause of chest discomfort, bilateral fissural thickening after blood transfusion? It is a fluid overload. Infant mortality rate. It is the most sensitive indicator to know how is the healthcare availability, healthcare resource utilization, facility utilization. How effective are the healthcare programs in the community? कैसे पता चलेगा? Infant बच्चा लोग कितने मर जा रहे? Infant mortality, IMR is the indicator. The spike and dome pattern on kidney biopsy with microscopic hematuria, classical of membranous nephropathy. A smoker who has chronic cough, weight loss, hypercalcemia. As I told you, every NEETPG exam, doctor, invariably one question come on the paraneoplastic syndromes. So you should know everything about them. Eaton-Lambert syndrome, Cushing's, because the ectopic ACTH production, where do you see? So lot of times all these endocrine manifestations of the paraneoplastic syndromes in lung cancer are because of the small cell carcinoma. Exception is hypercalcemia, which is caused by squamous cell carcinoma, is fortunate to remember. Intermittent swelling of the knees, large retroperitoneal hemorrhage, it indicates factor 8 and factor 9 deficiency is what you need to remember. सीमेंट फैक्ट्री में काम करने वाले को एस्बेस्टोसिस के वजह से मेसोथेलियमा होता है. The nutrient intake level, which is sufficient to meet the requirements of nearly all the healthy individuals, उसको कहते हैं RDA. Once more, what is RDA? What is specific dynamic action? What is respiratory quotient? What is net protein utilization, NPU? Everything you should know. So that completes 133 questions, doctor, in the NEETPG 2023. They asked all the remaining image-based questions. They shown a gonorrhea image. Ceftriaxone is the treatment of choice of gonococcal urethritis. They shown a cephalohematoma image, parietal swelling since birth. They shown a putty kidney image, sterile pyuria and abdominal pain. Typically is TB, renal TB. And transversalis fascia defect was shown, image-based. Glomerulus of the kidney, you should know how to interpret histology. Then one question on aortic arch, defect in 6th left aortic arch is given in the image. Median umbilical ligament, medial umbilical ligament. So you should know all the embryonic structures and their adult counterparts. So phacoemulsification technique was shown. Immature sterile cataract is managed with phacoemulsification IOL. Pinguicula, small scleral nodule image was given. Mixed aerobic, anaerobic infections indicate necrotizing fasciitis image was given. Keloid was shown, asked you to identify, you should know keloid and hypertrophic scar and all the differences you should be very, very sure about. Now, doctor, the liver with the echinococcus, hydatid cyst was shown. Surgery is not always mandatory. And a contact allergy because of the hair dye में p-phenylenediamine के वजह से skin reaction was shown. Head tilt, chin lift at the time of airway securing in the CPR, you must be very sure. In the basic life support, advanced life support, you need to be very sure. Malignant melanoma image, frontal mucocele with a non-axial proptosis image was shown, and a post-operative image of a patient who underwent total laryngectomy for laryngeal carcinoma was shown. The vitamin D deficiency is curvy, wind-swept appearance, bony deformities has been shown. Subdural hematoma, which is crescentic shaped in a confused ataxic elderly patient without history of trauma. Biconvex shape of the epidural hematoma, which is arterial bleeding with a history of trauma with lucid interval. You should be very sure. Radial nerve injury, cock-up splint, you should know. Now, omopatrilat, what is the mechanism of action? image-based question. Biparitate patella, how does it look like? In a chronic knee pain patient, X-ray, you should identify. A trophic ulcer on the lower extremity image was being shown. Fibrous dysplasia, what is that called? Shepherd-Crook deformity on radiology, classically was shown. A giant cell tumor, soap bubble appearance in a 22-year-old female. You should know how to identify on the image. Once more, lung volumes ke bare mein, one MCQ, sure shot to come, doctor, be very sure. So, we conducted 50 full-scale mock tests, each containing 40 image-based questions and 160 clinical case vignette-based questions, and all the 200 explanations are provided as 200 mind maps, each containing 10 high-yield facts. Everything is USMLE style, the clinical vignette type, like the actual NEETPG exam. So these 50 full-scale grant tests are being provided as PDFs on the learnograph.com. Just download, sit with your friend, solve the paper first, discuss internally. So all the 50 grant tests, if you solve, it's a cakewalk to become the winner. So PYQs give you awareness what to read. Then we have a series called Snapshots on each subject, around 2000 high yield facts and 150 to 200 mind maps. Snapshot series will give you the real depth into each subject, quickly to do revision in 150 mind maps. 50 full-scale grant tests will give you enough practice. On the top of it, Dr. Murali Bharadwaz with you every day. So stick to the learnograph.com. Please like this video, share this video, write your comments below this video, and we will meet every day. Don't dishearten about the postponement business. This is the time where you reinforce, reaccumulate your energy, call the forces into action, and then fight for the upcoming exam. So thank you very much for this midnight masala session of the Insomniacs for the NEETPG 2024 attack batch with Dr. Murali Bharadwaz. Good night.